In this video, we will begin to look at Medicare Part A coverages, costs, and copays. Original Medicare is made up of two parts. Part A is hospital coverage, and Part B is medical coverage. First, let's look at Medicare Part A. As long as you or your spouse have worked at least 40 quarters or 10 years in the U.S. and have paid Medicare taxes, you will not be charged a premium for Part A. If, however, someone has not met this requirement, meaning they have not paid into Medicare for a full 40 credits, they could have to pay a premium for their Part A coverage on a sliding scale based on their credits. But for most, there is no charge for Part A. What does Medicare Part A cover? Medicare Part A covers inpatient care in hospitals or what is essentially room and board or facility fees. It pays for a person's room, bed, linens, food, and so forth. Things generally associated with providing you a place to stay. It does not cover the physician and specialist services that a person receives while in the hospital or anything medical, anesthesia, medical equipment, etc. For a hospital stay, Medicare provides for coverage up to 90 days. Now, days 1 through 60 have a deductible, and days 61 through 90 charge a per-day copay. There is also an additional 60 days of coverage called lifetime reserve days. Lifetime reserve days can only be used once, so should someone be in the hospital for more than 90 days, they will start to use up their lifetime reserve days beginning on day 91 and pay a per-day copay. A person doesn't have to use the reserve days all at once, but once they are gone, Medicare will only provide for 90 days of hospital coverage per incident. Part A also covers care in a skilled nursing facility, not to be confused with a nursing home or long-term care facility. Skilled nursing facilities are for short-term rehabilitation care where someone can recover from a surgery, illness, or medical condition before being sent home to care for themselves. Coverage for a skilled nursing facility requires a 3-day hospital stay and has a maximum stay of 100 days per benefit period. The person must be showing improvement for the stay to be covered. If they are not improving, it is then considered a long-term care situation, which Medicare does not cover. Medicare Part A will also provide for home health care, which means having a skilled nurse come into a home setting to provide specific care. Now, Part A also covers hospice, the end-of-life care a person receives when they are no longer seeking medical treatment for a terminal condition and have a life expectancy of 6 months or less. Some things not covered under Part A would include physician services, personal care items, private hospital rooms, and custodial care, which is someone coming into the home to attend to cooking meals, bathing, help with dressing, cleaning, and so forth. What are the costs associated with Medicare Part A? If you had no form of insurance other than original Medicare, there is a deductible for Part A. That deductible covers the first 60 days of a hospital stay. If the stay is longer than 60 days, from day 61 until day 90, there is a per-day copay. Now, if someone is still in the hospital after 90 days, the lifetime reserve days will be used, and there will be a per-day copay for days 91 through 150. For skilled nursing, after the required 3-day hospital stay, Medicare will cover 100% of the first 20 days. If the stay is longer than 20 days, there is a per-day copay for days 21 through 100. If a skilled nursing stay goes longer than 100 days, Medicare will stop paying and will fall on the patient as out-of-pocket costs. And again, keep in mind that Medicare will stop paying if a person is not showing improvement. As for home health care and hospice care, Medicare will cover 100% of those approved services. We here at VibrantUSA are independent, trusted, and unbiased, and ready to serve you.